COVID-19 may be top of mind for families around the valley, but the dangers of vaping, those didn't go away. In fact, teens who vape are more likely to catch coronavirus. First News reporter Simone Blair looked into how parents can protect their kids.
These days, I think COVID-19 is basically dominating all of the health news. But that concern about tobacco use and vaping use is still an issue.
A recent study showed that teenagers and kids who vape are up to 7 times more likely to contract COVID-19 than their peers. With the stress of the pandemic, Dr. Mike Sevilla says open communication is key to keeping teenagers from vaping.
I try to bring that up with parents and with my adolescent patients. Sometimes I use that for stress.
A national study this fall shows that the number of teenagers who recently used vaping products is dropping. Last year, 28% of high school students said they vaped. This year, it was just 20%.
A lot of that was from, hearing about the illnesses and the deaths at the end of last year.
But Sevilla worries it may not continue decreasing. Schools played a large role in communicating the dangers of vaping last year, a message that's harder to deliver with remote or hybrid learning.
The preventative messaging of not taking up vaping is not there in the curriculum because obviously schools are more focused on the essential learning.
Instead, Sevilla speaks with teenage patients when they visit his office.
I try to talk to them about vaping or substance use, and I think a lot of health professionals out there have that opportunity to make that impact with kids.
In Salem, Simone Blair, WKBN 27 First News.